it's Dr. Steve Novelli, and thank you for tuning in. Hope you're having a great day. I'm here to bring to your attention a huge problem that your auto injury clients are having literally at this moment, and it's been happening for years, and it's a problem. And it's a problem that is tremendously undermining the value of many of your clients' cases, and honestly, it's unbelievable to me that nobody has taken the time or had the precision needed to solve this problem, but ultimately, that's why I'm here. So we're going to solve this problem together because I'm absolutely confident that I can bring you a tremendous solution to the table that can increase the value of many of your clients' cases by factors of 5 to maybe 10 times the value of what many of the cases are currently settling for. So I represent a network of doctors in Western New York who implement my advanced diagnostic process. I call it my ADP. It's an advanced diagnostic process, and we use it to diagnose auto injury patients in a pinpoint accurate and extremely precise way, much more so, by the way, than most doctors normally do. Unfortunately, the problem is that most other doctors are poorly diagnosing and really underdiagnosing auto injury patients because they don't have the knowledge and the tools and the skill set to really do a thorough job. And ultimately, this underdiagnosis leads to an undervaluing of your cases because in most other doctors' examinations, there's no objective evidence of serious injury. Now, all of that changes as soon as the doctor decides to implement my ADP, my advanced diagnostic process, that uses objective measures of permanent impairment that are recommended as gold standards by the American Medical Association. My ADP really gets down to the nitty-gritty of what is actually wrong with this person and absolutely diagnoses with pinpoint accuracy the seriousness of their injuries. In the analysis of your clients, objectivity is incredibly important for proving serious injury. Now, only 2 things are truly objective according to the American Medical Association, and that is imaging analysis, like X-ray and MRI analysis, and second, electrodiagnostic testing, meaning PF-NCS or EMG testing. Now, imaging and electrodiagnosis are 2 important components of my ADP, and attached to this email are examples of 1, the ligament laxity X-ray analysis, which proves permanent injury in the spine, and second, PF-NCS testing, which proves nerve injury. Now, PF-NCS testing, it's much more sensitive than EMG, and we're discovering far more nerve injuries than previously discovered with EMG. Approximately 90% of people in auto injuries have positive results on these 2 tests, and that's leading to much more specific and accurate diagnosis of permanent injuries. These injuries have been there the whole time, but most doctors didn't and still don't have a process for identifying them, but we do. Now, I just completed a 1-year study with hundreds of patients, and the results are actually quite tremendous. It showed that 90% of our auto injury patients have permanent spinal injuries. 90%, okay, which is a huge number, and these are serious injuries, and these people need a fair outcome in their cases. Unfortunately, I see all the time that people's settlements are far less than what is fair, and their whole life is turned upside down because of this injury. So it's extremely important to me that we work together on getting this thing figured out for my patients and for your clients. Because just imagine if you had objective proof that 90% of your clients are actually seriously and permanently injured. 90% is a huge number, and I'm confident that having that information would do tremendous things for your clients. So, we do many second opinions for auto injury patients in this Western New York area, and we see some really, really interesting things on a regular basis, and I'll give you a real example of a case that happened just last week where the attorney actually called the patient and told him that he was concerned that the client didn't have serious enough injuries for the law firm to actually devote the necessary resources to pursuing this case. And so he cut the patient loose, and so the patient goes to get a new attorney, and the new attorney refers the patient to me to go through my ADP, my process, because the attorney wanted to see what's going on with this guy, what's been overlooked by previous doctors, okay? So it turns out that my ADP shows that the patient has had serious injuries to his neck, which have resulted in instability, and it's going to require surgical fusion to correct, okay? So we figured out what's wrong, and the new attorney is obviously happy that the patient is getting the right treatment, which is fusion to his neck, and that's ultimately going to result in a fair outcome, a substantial outcome for this case, okay? So the case goes from the first attorney, in his perspective, that this is not worth anything, to getting a thorough workup with me through my ADP, and a new attorney's perspective, and it turns out to be, potentially a six-figure case according to the new attorney. And really, I don't blame the first attorney in this case or other cases for these mix-ups, because I really blame the doctor for not doing a thorough job to provide the attorney with the medical proof that they need to really do a great job for their client. It's really the doctor's responsibility to diagnose to the most specific degree possible. And that's what we're doing, and that's what we do, and that's what we specialize in solving many of the problems that I would say probably pretty confidently that you have going on right now in your practice with potentially many of your clients. And this is a huge, huge issue. And working together, we can solve this, okay? So if you're ready to work together with me and help take your clients' cases to another level of medical specificity and ultimately outcome of the case, please give me a call or reply to my email. Let's find a time to talk and perhaps do a sample of 5 or 10 of your cases together and see what we can do for your clients, because ultimately, if we don't do this together, it's a disservice to the client in terms of their health and the outcome of their case, and 2, it's a disservice to you, because you need to know which cases to devote resources to and which ones to hand off, and to do that, you need certainty and you need precision when it comes to the diagnosis of your client, and that's what they need to get a fair outcome. They need certainty and they need precision. And that's what I can bring to the table. Thank you for listening. Have a nice day.